Hi, everyone. It's Marina Kukla here from the WORKWELL study to talk about cognitive behavioral therapy for work success and specifically awareness of automatic thoughts. This comes into play, especially as we go later on in sessions. When we hit session 4 and we introduce the 4 A's, we start to take people through this. This is the idea that sometimes what veterans present to us and what they actually mean are two different things. And then we can kind of read between the lines to identify those automatic thoughts that are tripping them up or causing problems that are unhealthy and unhelpful. And then we should use the 4 A's to be aware, assess, and answer those thoughts. So I'm going to talk today about that. So some things I'm going to touch on first is how to be more aware of those automatic thoughts or those thoughts underlying what the veteran is telling us, and then bringing those to the surface using first-person reflections and offering your own thoughts about what you think may be going on. And then once you have identified the sort of index thought or the key thought that needs to be assessed and answered, walking that veteran and the group through the 4 A's using that as your core thought. And then fourth, I am going to offer some examples of what we commonly see. We see sort of frequent patterns, even across veterans, that tend to come up a lot. So I'm going to bring some of those examples in, and then there are a few pitfalls to watch out for, and so I'm going to comment on those. So what is an automatic thought? So these are thoughts that tend to occur quickly, and we may or may not be aware of them. Oftentimes in CBTw, these thoughts are sort of secondary to the initial scenario or the explicit thought presented by the veteran. So what we want to do, though, is that we want to focus on the problematic ones that are getting in the way of people's goals, their work goals, or other things they're trying to do. So these are those thoughts that might underlie the scenario presented that are unhelpful, unhealthy, and they may be inaccurate as it relates to those veteran-specific work goals. So one key note is that a lot of times a veteran might present something that is actually factual or accurate, and that's not what we want to focus our CBTw work on, or in this case, our 4 A's, if that's what we're using that week. So a couple of examples that these are just examples from veterans, and I changed them a little bit, but this kind of stuff comes up a lot in group. So one example would be you're doing a 4 A's didactic as a group, and veterans go off on their own to do their own in their workbook or their manual, and a veteran comes together and says, my example is that my PTSD symptoms get bad when I work around machinery in my job. Well, that might be very factual. That is something that this person experiences that's very real. Another example would be someone says, my back is so messed up that I can't get under a car anymore, and my job as a mechanic. That might be also very real thing. And so those aren't the things we have to try to assess and potentially answer. But there are lots of thoughts that underlie or go along with these scenarios. And that's usually what veterans mean. And so they may not be able to self-reflect or be aware of those, but that's where we as facilitators can play a role by offering up our own thoughts of what we think they might be thinking in this situation based on our knowledge of them as individuals, our knowledge of other people and what's commonly experienced in these situations, and our knowledge of ourselves and how we might think and feel in this type of situation. So I'm going to go through this example, the first example, which is the veteran says, you're doing the 4 A's, and the veteran comes back after they've had time to work on it and says, my PTSD symptoms get bad when I work around machinery. So this is factually accurate. I'm not sure that there's a lot here for us to actually assess, but maybe our time is better spent facilitating that veteran's reflection or awareness on what thoughts might be underlying this fact. Now, for some people, those thoughts might be healthy, and so not something that we want to answer or change. But for a lot of people, understandably, there might be some thoughts under the surface or not so under the surface that are unhelpful or unhealthy or both. And so we'd want to assess and answer those specifically. So this is where we might think about underlying perceptions of the situation, and common ways that those perceptions could impede work goals. Consider what you know about this specific person, how they think, what their barriers are, and what they often experience. Consider mistakes in thinking and common thoughts that map onto those. So for example, the first day someone comes in and has some PTSD symptoms, when they're around a machine, they might say, well, this is it, I'm going to have to quit tomorrow. We might agree that that would be an example of catastrophizing. So if this is a person you know, and you know that he or she or they tend to catastrophize, you might guess that their thoughts might align with that. And you can also ask yourself, if I experience this, what might I think or worry about in a similar situation? So the first thing you would do is just reflect what the veteran has said using first person if you can. So in this case, I've added a little bit more here because presumably the veteran has offered a more in-depth scenario of what's going on, or maybe you've asked some questions, some follow-up questions, and now the person's saying a little bit more about what's actually happening at work. So he says, so you would say as a facilitator, it sounds like you're saying, when I'm around machines at work, my PTSD gets bad. I get all amped up. It's hard to concentrate on what I'm doing and get my work done. Okay. And you've reflected this based on more information that has been offered or that you've asked about from this veteran. So now this might be factual. My PTSD gets in the way. I have trouble thinking. And then I notice that I'm not as effective or as efficient. I'm not getting my work done, and it's a problem. So that might be fairly accurate and factual. So that's not the part we want to focus on with the 4As or in CBTW so much. That's a very important reflection and a very important narrative that this person has offered up. This seems really important. So that's the first thing, is that you've done a really good job getting those details. So step 2, now, based on your understanding and your best guess on what the veteran means and what they might be thinking, you would offer up that thought. Oftentimes you're going to be right, or it may be very similar to what they're thinking or experiencing, or if not, other people in the group have probably had that thought at times. And so even if it's not 100% correct, it would be useful to use it as a thought to assess and answer and act upon in the 4As in our example here. So for example, you might offer up next, you might say as a facilitator, sounds like you're having PTSD symptoms at work. Now you're not sure what to do about that. You're saying to yourself, I can't continue in this job. This is too hard. I'm going to fail. That last part that's underlined here is what we're going to work on and actually target in our 4As example, not the behaviors that came before it or their description of their symptoms, but actually the underlying perceptions of how they're understanding this and what this means for them. Maybe this person hasn't had these exact thoughts, and he might say, no, that's not right. But what I'm actually thinking is, my symptoms are going to ruin my life, or my symptoms are going to, I like this job and my symptoms are just going to throw it all away, or something very similar to this. Sometimes what I do is I'll say to the person, maybe this isn't exactly what you're thinking in this situation, but would it be okay if we use this as our example for the group to see how we can use the 4As to help our thinking a little bit? And how can we assess, be aware, assess, answer that thinking, and act in a way that supports that thinking towards our work goals? So I will ask, is it okay if we use this, even if it's not 100% what you are thinking right now? And I've never had a person say, no, you can't do that. And sometimes this is a little bit more efficient and quicker way, rather than you can sometimes continue to work with that person to explore what their thoughts are, and that would be fine too. But oftentimes we don't have a ton of time, and that person might not be able to do that level of reflection yet. It depends on the individual and various factors, which would dictate the level to which they could self-reflect. So the next thing, now that you've settled on this automatic thought or this underlying thought that's underlying this situation with the PTSD symptoms at work, you're going to do the 4As now. So, and again, you want to make sure you know what thought you're working on. When we do this in person, we usually write the thought on the board so everyone can see it. And you can use whiteboard on Zoom or other things. There's other ways of doing this. You can type in your fillable PDF. That's a great way of doing it, and share your screen. But then you would go through this. Again, the thought is, I can't continue in this job. This is too hard. I'm going to fail. So you just did the aware step. So nice work. Next, you're going to go to assess and answer. So that you would go through with the group, and you would ask whether this is healthy or unhealthy, helpful or unhelpful, accurate or inaccurate. Don't get caught up on the accuracy piece. Focus more on the first two. A lot of times we're kind of mixed. We might say, well, if I keep having symptoms, this might ruin my career or my job or my life. And no, that's probably not accurate. That's probably some black and white thinking, or some jumping to conclusions, or a little bit of catastrophizing. But we can probably all agree that it's not really that healthy and helpful to think that way. So then you move on quickly to the answer step. And this is where you want to spend a lot of your time with the group, which is generating multiple answer thoughts to the above automatic thought that I've underlined here. So I've come up with some kind of basic, a little bit not that exciting answer thoughts, a little bit generic even, but to this one. So one thought could be, this is hard, but I like my job and I want to keep it. I'm good at it. I can do things to deal with these symptoms. Or I've dealt with this before when I'm extra stressed. I can deal with it effectively again, and I can keep working. And there could be a million better answer thoughts that the veterans will probably come up with than the one I've come up with here. So anything that's healthy and reasonable, you would say that's a wonderful answer thought. That's awesome. So next, you would move on to the last two A's, which are act and accept. So again, this is specific to our thought. I can't continue in this job. This is too hard. I'm going to fail. So again, for act, it could be a generation of any number of healthy or helpful behaviors. Some examples, I can talk to my boss and ask about short breaks during the day, which help my symptoms. I'm going to talk to my wife about this stuff that's bothering me. Getting it out to her helps. I'm going to start going for runs again. Exercise really improves my symptoms overall. Could be another 1,000 different things that would be helpful. So, and then you would go to accept, and this is a little bit similar to the answer thoughts. I have PTSD symptoms, and it's really hard. And sometimes people are really suffering, of course. I can't always control when my symptoms come, but I can succeed in a career and get this figured out. I've had PTSD for 10 years, and I've been promoted twice during that time. There is hope for this. I can't change my PTSD necessarily, but I can accept that these symptoms come and that I can deal with them. I'm worthy of having success, and I can have success at work. These would also be good answer thoughts. And so you can see that there's overlap there. So I have some other examples of automatic thoughts or underlying thoughts. So what the veteran says or presents in the group versus what you might reflect back and work on using some of our main frameworks, including the 4 A's. So veteran says, I'm having a hard day. My car got repossessed, so I didn't show up to work. What they might actually mean or be thinking is, I'm freaking out and overwhelmed. And I've underlined the automatic thought or the actual thought that we would want to work on here for the 4 A's. I'm freaking out and overwhelmed. This is too much to handle. Quitting would be easier than dealing with work right now. The underlying part is what you would want to reflect back, try to get to, and then focus the 4 A's on. Number 2, veteran says, I got into it with my coworker yesterday, so I just left in the middle of my shift. What they mean, the underlying thoughts there could be, I was going to fail yet again, and that would be humiliating, so I avoided my supervisor and walked off before she could fire me. Now, here it's really a combination, as many of these are, of both thoughts and behaviors. For the 4 A's, we're focusing more on thoughts. Of course, we care about behaviors, we care about reflecting those, but if you're trying to do a 4 A's example, You want to focus on being aware, assessing, answering those thoughts, and then acting and accepting. So you focus on thoughts. So the thought you might focus on here was, I was going to fail yet again. She was going to fire me. And maybe it's true, she might have fired him, but the thought might be, I was going to fail again, and that is too unbearable to deal with. So I left before I could be fired. So that's what you might work on. Number 3, veteran says, I'm 69 now. I went in to do the job application and I couldn't even do any of the computer-based stuff. All the other people applying were like 25 in that store. I think I'm done looking for work. What automatic thought or other thought might underlie that narrative or this scenario they've just put out here to you? I'm obviously too old to work. I'm a fraud. I can't do this. I won't have success at this age. No one will want me at this age. Those are all thoughts that would be maladaptive, unhelpful, unhealthy thoughts that are very worthy of addressing using the 4 A's. These are just some examples of what a veteran comes into group and says, or they say, here's my 4 A's. I'm 69, I couldn't do the computer, everyone else was 25, that's it. I think I'm done. What they actually mean are all of these other things. So these are some things as facilitators, one of our key roles is to reflect and to help them get to some of this if we can, or just to offer up our own thoughts about this. So what are some things that you could look for that would tell you it's time to use these types of reflections? So defeatist or negative thoughts, or the way they might describe a situation might be very negative. It could be hopelessness. It could be, you might see some of our common mistakes in thinking, like catastrophizing, fortune telling or jumping to conclusion, assuming things will turn out bad, assuming one scenario means everything is ruined, minimizing. So we see this a lot when people come in and they're doing their weekly work update and they say, I haven't really done much this week. Oh, but I also put in 3 applications and met with my voc rehab counselor. And that's minimizing. They're minimizing their efforts there, or they might minimize their success at past jobs when things have actually gone well for them. Something else that comes up a lot, and I used it in my examples here in this little video, is self-sabotaging behaviors. Walking off the job, not showing up, getting in arguments or conflicts with coworkers, with the boss, other things, being avoidant of what they need to do to find work, or those are all indicators that there are automatic thoughts or underlying thoughts that you should look for. That would be a good time to, if you can, to offer those reflections in that moment based on all of these factors that we've talked about, what you know about the veteran, their tendencies, how you might feel in that situation, how others might feel in that situation, other veterans you've worked with in voc rehab. As people are trying to get jobs, we see these patterns over and over again. So these are just some things to consider. And then what are some common pitfalls? So what not to do? I mentioned this earlier, but don't get too stuck on the accuracy facet of the 4 A's, because sometimes it's a mixed bag. There might be some truth, especially when people, they might say, you know, I failed a lot in the past, or things have gone really badly for me at work. I mean, that might have a lot of truth to it, but they might have really unhealthy thoughts about that fact or about those things. So don't get too stuck on whether or not something is accurate. And if you do get stuck, you might ask yourself, are you really focusing on the problematic thought that's underlying this situation? Or are you focusing on something else? Are you focusing on a fact of the matter, like having symptoms, or not having a ride to work, or living really far away from a job and not being sure how you're going to get there? Or are you actually focusing on one of those problematic thoughts that the 4 A's can deal with? Another pitfall would be applying the 4 A's to a behavior rather than exploring those underlying or automatic thoughts. That was a lot of what I described here. And a lot of times veterans have difficulty knowing the difference between thoughts and behaviors. And so when you say, let's do the 4 A's, they're going to come at you with a work-based or other-based scenario that doesn't describe a thought. And so if we get down into the weeds on that and we can't help them work their way through it, then we can have a lot of trouble, because you can't really do the 4As like that. The other thing would be not anchoring your assessment of those thoughts to veteran specific goals. I think most people get really good at this, but a thought is unhealthy or unhelpful to the extent that it hinders goals. And most of the time it's obvious, but some people are not really sure if this helps them or not. And thinking about what that individual's goal is or goals would be helpful to do that assessment piece. And then lastly, remember to insert your own thoughts or reflections. That's one of our biggest roles as facilitators, where we can help veterans. And you can make them very basic reflections, even more basic, much more basic than what I've presented here. So a person has symptoms, and you might say, I'm gonna lose my job. That could be the thought, or everything's gonna go bad. It could be just something very basic like that. And just remember, it doesn't have to be the perfect or the exact thought. Even if it's not, it's probably something that this veteran and other veterans have thought in the past, and they may think often about themselves in this way. So don't feel like you have to have every reflection be 100% accurate. It really doesn't need to be. And we can still learn and grow and benefit from it if we can apply the 4As and use it as a tool or a vehicle that helps us learn how to do that effectively. So that's what I have for today, thinking more about underlying and automatic thoughts. Thanks again for listening, and I appreciate your job as facilitators.